here we will be dealing with trematodes. So as you know, trematodes, there will be blood flux will be there, liver flux will be there, intestinal flux are there. So we'll go through that. Okay. So first, you want to remember this classification, which is very important. So blood flux, you know, Hematobium, Manzoni and Japanicum. So liver flux, it is in Clonarchus sinensis and Fasciola hepatica. And intestinal flux, it is in Fasciola busci, Heterophyes and Gastrodiscoids. So lung flux, it is nothing but it is in Paragonimus westermani. So here, you want to remember the infective forms for the trematodes. It is in metacercarial larva for all the species. Okay, so that is all the species. These are all. It's like liver flux, intestinal flux, and the lung flux. And except for cystosomes, it is an cercarial larva. Okay. So next. So first we will be dealing with an blood flux. Okay, Cystoma, Hematobium, Manzoni and Japanicum. Okay. So first the habitat, the Cystosoma hematobium usually resides in the vesicular plexus, that is in bladder. Okay. So whereas Manzoni, it is present in the inferior mesenteric vein, whereas in Japan, it is in superior mesenteric vein. You can remember like Japan, which is a developed country, which is always used to be in. I will be taking an as example for the intelligence, everything, right? So you can always remember that Japanese or superior. Okay, so just for the remembrance sake, I am saying. And coming for intermediate host, just remember all are snail. So there is no confusion. You definitely host man. Okay. So infective state cercaria. So what I told is, but for all these systems, it is an metacercaria. But for all the flux, it is in metacercaria, except the blood flux, it is in cercaria. Okay. So coming for clinical features, it has in cercarial dermatitis and urinary cystosomiasis. Here cercarial dermatitis and the Katayama fever, and here cercarial dermatitis and the Katayama fever. Okay. So here friends, you want to remember in hematobium, it usually associated with the bladder carcinoma, and that too it is a squamous cell carcinoma than the transitional cell carcinoma. Okay. Next, it is in how we will diagnosis by, here you know it is a urine sample, here stool and stool. So the only differentiating feature is in hematobium, it is in terminal spine. Okay. In Manzoni, it is in lateral spine. In Japan, it is a knob, lateral knob. Okay. So if you remember these points, it is enough. So friends, again, so I will be posting a video and I will be giving that link in the description box, that is mainly for the parasite causing the anemia and the parasite causing malignancies. Okay, so kindly go through that also. And so here, next it is in Paragonimus, Fasciola hepatica and Fasciola busci. Okay, so here if you remember, I don't know, Paragonimus westermani in the lungs, hepatica, so liver. So busci, it is in small intestine. So here you want to, these are not that much important friends. Okay, so just remember snail. Okay, more than enough, and definitely host, it is in man. So as a broad, you can remember for this, when you're dealing with the trematodes, the definitely host is usually man and intermediate host is usually snails. Okay, the exception will be here, there is a fish and aquatic plants. So infective form, I told no, it is a metacercaria. And clinical features, since it is a lung, it is always associated with pneumonia, and there is another term called as an endemic hemoptysis. Okay, whereas hematobium usually causes an hematuria, and here it is usually causes an endemic hemoptysis. So here Fasciola hepatica causes an cholecystitis, cholangitis and cholangiocarcinoma, whereas busci usually causes an abdominal pain, vomiting and diarrhea. So these are all of the operculated, that is they will be having a knob at the top. So what is the drug of choice for all the trematodes? You can give the praziquantel, except Fasciola hepatica, it is a trick albendazole. Okay. So this completes the trematodes. Next we'll be dealing with nematodes. So here, So nematodes, you can like there are see friends, I'll be okay, 5. You want to remember the 5. So among that, in this 3 will be residing in the small intestine. What are this? Strongyloids, ankylostoma, nectar, and the ascaris. The host, as usually, is a man. And infective form here, strongyloid, it is an filariform larva, and for Necator americanus it is an filariform larva, and for Ascaris it is an egg. Okay, so in Strongyloid circularis there is some of the peculiar term you want to remember here. So 1, it is also called as a military worm, and it also causes a larva occurrence, that is it can travel at a speed of 10 cm per hour under the skin, and it usually causes an auto-infection, abdominal pain, diarrhea, and low-flux pneumonia. So ankylostoma usually causes a ground itch. What is a ground itch is there will be extensive itching at the site of entry, and there will be an abdominal pain, diarrhea, and low-flux pneumonia. So these 3 are associated with the low-flux pneumonia. So but Ascaris usually causes a mechanical obstruction of intestine and malnutrition. Okay. And how will diagnosis? Here in Strongyloids it can be either egg or it can be larva. In ankylostoma and nectar it is an egg or the larva, and in the stool examination of we can detect the eggs in the Ascaris lumbricoides. Okay. So next, coming for entropius. What I told is they 3 resides in small intestine, but this entropius and trichuris will be residing in the large intestine. Okay. So here the host is man. The infective form is for both it is an ingestion of the egg, and for entropius it is auto-infection, abdominal pain, and perianal periods. There is a famous history, a child came with the complaints, a mother came with the complaints that a child is child has what is it, nocturnal itching, usually in the anal region, which is usually more aggravated at the night time, because at that time the entropius usually lays the eggs in the perianal region. Okay. So next here you want to remember is abdominal pain, iron deficiency, anemia, and rectal prolapse. So this trichuris, the important term is here rectal prolapse, and there is another term called as a coconut cake rectum. So how will we diagnose this? That is, that is an NIH swab or the cellophane tape method. Just you will be taking the cello tape and you will be just placing it over the anal region and strip it off, and then place over the saline, and you can place it over the slide and observe under the microscope. Okay. So stool examination here for the eggs. Okay. So treatment here you can remember like, so all the nematodes will be giving an albendazole, except strongyloids it is an ivermectin, and for the entropius it is an mebendazole. Okay. So next it is an Trichinella spiralis and Dracunculus medinensis. So friends, what I am saying is these are all about the intestinal. Okay, we dealt with an intestinal nematodes. Now we will be dealing with some can resides in the muscles and subcutaneous tissues, right? So Trichinella spiralis usually resides in the muscle, whereas Dracunculus in the subcutaneous tissue. Here the intermediate host is a pig. Here it is in Cyclops. Definitive host is usually a man. Okay. So here both the ingestion of the larva only. Okay. So here here it is an L1. Okay. So next, it usually affects the ocular muscle, skeletal muscle, and myocarditis. It is the most common manifestation. Here there will be at the site first there will be developing a papule, then blister that will be rupturing, and there will be releasing an yellow sterile. That is a term here. The yellow sterile liquid will be released. Okay, so you can demonstrate the larva in the Trichinella spiralis, and just here a famous technique called as a matchstick technique for Dracunculus. Just they will be taking a stick and just they will be rolling over on the worm to remove the worm from the site. So treatment here it is an mebendazole. Okay. So another term, another is the Dracunculus medinensis has been eradicated from the world. Okay. So next we'll be dealing with now lymphatic and subcutaneous worms. Okay. So coming for filarial worm, it is an usually resides in lymphatic or subcutaneous. So intermediate host here it is in culex. So I'm just giving a broad. Okay. The main I'll be saying here. So infective form here it is in filariform larva. So just remember this friends. So here the Wucheria bancrofti, the meat that is in vector it is in culex. For Brugia malai it is in Mansoni. So and here subcutaneous loya usually causes an the famous term that is in Calabar spelling, and onchocerca valvulus causes a river blindness, and some other conditions also there that is in Sauda, and there's leopard skin. Okay, and these are the term which is usually used in the onchocerca valvulus. So next, how will you diagnose? So remember so for microfilaria larva, it is usually surrounded by sheath and the nucleus will be present inside the body. Whereas loya till the tail tip. Okay, so nucleus will be there till the tail tip. Whereas onchocerca there will be no nucleus. So just remember O. O means 0. Nothing is there. So no sheath, no nucleus. Okay. So Frugia malai, it is in 2 nuclei. Okay. So I used to remember like brew, it is an, I think you all know it is a famous coffee brand. So I used to take about 2 times a day. So morning and the evening. So there will be 2 nuclei in the tail tip. Onchocerca, there is nothing but. So you want to remember loya. So it is like, what is it? I was saying like both loya. So it is, it was a bottom and so it is extending till the tip of the tail. Okay. So I didn't describe about the morphology of the eggs, etc. Right? So because I have been posted a separate video for how to identify the eggs. Okay. So I'll be giving you a description box. If you want, you can go through that. Okay. So treatment, as you know, always Wucheria bancrofti it is an DEC, and onchocerca it is an ivermectin. So just for recall, strongyloids also I will be giving an ivermectin. So next it is in cestodes. Cestodes is nothing but we'll be dealing with Tinea solium, Tinea saginata, Diphyllobutherium latum, Echinococcus and H. nana. So friends, again there is some other terms. Okay, so like if it is Diphyllobutherium, it is called as a fish tapeworm. H. nana, dwarf tapeworm. This is a dog tapeworm. I don't want to repeat it again and again because so I'll be giving all the parasitology links in the description box. You can go through that. Okay, so in this you want to remember, so just for completion's sake I have posted here, but if you remember this fish, ingestion of undercooked fish, ingestion of contaminated food in the water, and it also causes auto infection, and it oh sorry friends, I think this is not okay. So here Echinococcus, it is also again by the ingestion of the contaminated, so the waters, everything will be okay. So here definitely host is man. Always remember, I don't know if it is a toxoplasma, it is an what is that cat. If it is Echinococcus, it is always usually it is an dog. Okay. So here next it is an, so infective form, it's mainly it is an 3rd stage larva. Here it is usually because of an again a larva because of skin penetration, but here it is an egg. Okay. So here next clinical feature, it is in diarrhea and pernicious anemia, that is in vitamin B12. So this H. nana usually causes an diarrhea, and here it famous that is called as an hydatid cyst. Okay. So a whole here examination, how you diagnosis, here the eggs, and here it is an what? It is in Cassona test or the serology test. Okay. So in this you want to remember this. It usually causes a vitamin B12 deficiency. So this is ingestion of the contaminated water. Okay. Sorry for the wrong option over there. And coming for Tinea solium, it is an ingestion of the solium pig. Saginata, it is an beef. Okay. So here definitely host is man. Intermediate host, here it is a pig, here it is in cattle. Okay. So the main form over here is infective form to man, it is a larval stage, that is a cystic circus cellulose. Whereas for cattle it is an eggs. So here for man it is a cystic circus bovis, and for pig it is an eggs. So you won't remember this, okay? This is little confusing. So you can remember like for both the animals it is an eggs. For the man it is an larva. But for here solium it is in cellulose and for Saginata it is in bovis. So clinical features, you know, as it causes an intestinal teniasis, cystic sarcosis. There is a term called as neurocystic sarcosis, okay? So how you can diagnose this? By X. You can demonstrate the X in the stools. So neurocystic sarcosis. So this is the most common parasitic CNS infection of the man and the adult onset epilepsy in the world. So friends, each and every point is important. It is in 1 mark, okay? So this is in 1 mark and this is in again MCQ. And the site, most common site is subarachnoid space and followed by parenchyma. So seizure, presents with the seizures and which is usually account for about 50% of the late onset epilepsy, and treatment is usually albendazole, praziquantel, surgery, and niclosamide is usually contraindicated in the neurocystic sarcosis. So here, though I have mentioned here, the praziquantel is a drug of choice for all these cystodes and followed by niclosamide. Okay, so for except hydrid cyst and neurocystic sarcosis, you will be giving in albendazole. Okay. So next, the final, it is in Plasmodium. So here you want to remember the 4 species. So one is Plasmodium vivax, Plasmodium malariae, Plasmodium ovale and the falciparum. So here each and every term is important. So first, which is an infective form to man, it is an sporozoid usually present in the salivary gland of mosquito. Okay, so this is by the direct bite. If it is transmitted by blood transfusion or by any vertical mode, then it is by tropozoite. So what is the infective form to mosquito? It is in gametocytes. So here there are some of the diseases which usually protect from the falciparum, that is in sickle cell, thalassemia, fetal hemoglobin, G6PD deficiency and ovulocytosis. Because here in ovulocytosis RBC will be very rigid, so that it is usually resistant to falciparum infection. And see, Duffy negative RBC is protective from vivax. So next, what is the nature of RBC? Like see, the falciparum will be affecting all. You can remember like fall all, so all RBC. Okay, so again you can remember like ovale and vivax. You can remember like ovia. Okay, so OVY, so it is an young. Okay, so for malaria you want to remember an old RBC. You can remember like I think Muller, it is a the famous female actress that is a female character usually in the Prema movie, and now when compared to that it is become an old movie, right? So you can remember old RBC. Okay, so fall all, so malaria it is in Muller, remember old, and OB, yeah. Okay, again OB also she's a famous character in Tamil Nadu because of that Big Boss issue, right? So just for remembrance I am saying, friends, you can keep whatever you need because we want to remember the concept, that's it. So now Schaffner's dot usually present in vivax, you know, right? What is that? Schaffner means in viva they will be usually the questions will be shuffled. So okay, so Maurer spot, it is in falciparum. So I used to now see MAUR. So if you somewhat if you make it out, see MAUR. Okay, Maurer falciparum. Z man is a male. Okay, so malaria, male, James 1 2 3 4 5. Here also 1 2 3 4 5. James and ovale. Okay. So these are the antigen reduction kit. One is an P-lactate dehydrogenase and the aldolase. This is for all the Plasmodium species, but only for HRP, that is an histidine rich protein 2. It is specific for the falciparum. So the final topic, it is in BBCA. So here the vector, it is a tick-borne. It is a zoonotic disease. So the diagnostic form here, it is a Maltese cross form. Okay. So here it is a Maltese. That is, in ring forms usually arranged in tetrads. It will be like the flower. Okay. So that's all. So friends, again I'm repeating, don't miss any single point, and I'll be posting all the parasitology mnemonics and how to identify the eggs and what are the common names which have been given for the parasite, because I did not say that points in this video because I told you already there is beef tapeworm, pork tapeworm. So I'll be posting all the links, kindly go through that. Thank you friends.